Welcome. I don't know if you've ever been down this way in Magee, but we're at the Medical Towers and we're in the pediatric ward. And with me today is Kelly Fuel, and she is the neonatal practitioner, nurse practitioner. And we're excited to have you. And one of the things she and I have been talking about that I thought was so interesting is I think often we forget that we can take care of you from pregnancy to having that baby and after the baby comes. And I wanted Kelly to tell you a little bit about our labor and delivery, because I think a lot of people are not aware of how good our labor and delivery is here.
Exactly. I think all moms have a choice in their health care from pregnancy to birth and beyond, and I think they deserve the excellent care, and of course we give excellent care here. Our labor and delivery unit is great. Our two obstetricians that we have that are in this clinic as well, right across the hall, Dr. Weaver and Dr. Dozier, they deliver in the labor and delivery unit. I work I guess you would say in kind of collaboration with them. They let me know what they've got going and coming, and we kind of talk about things, and they let me know if they want me there for those deliveries. After your baby is born here at Magee, it's followed very closely in the nursery for the first 2 to 3 days of life, and then we are offering services to follow that baby after it's discharged from home too, through the pediatric services that we have here.
I think Dr. Izzy, whom we did an earlier interview with several months ago when he came, we were so impressed with him. So impressed with him and his whole idea of wellness and the way he presented it and talked about for the children and that type of thing. So I feel like our pediatric department is very, very strong. How many patients do y'all usually see? Do you stay pretty busy?
We stay pretty busy. I believe since Dr. Izzy's been here, he's seeing 20 plus patients per day in the clinic, and then we have the babies, of course, that we follow in the nursery too.
That doesn't surprise me with as much sickness as there with the temperature changes and that type of thing. It's been something. Magee Hospital, I just think is a jewel, and it's just right here in the middle. Sometimes I guess that's why I think about it. Sometimes with the where the towers is built, to me it's like it's coming up out of the ground, you know, and it's a jewel and that type of thing. But our hospital does offer so many services that are available. Magee's Hospital is, of course, open 24/7. You can get in contact with any of these people, someone, at all times. And I think that's such a great thing, because if you don't live in a community that has a hospital, you really do forget. I've been so fortunate to grow up with a hospital always here that I did not realize, you know, not having a doctor or a pediatrician. Of course, we did not have a pediatrician for my children at that time when they were here, but for you to have this pediatric unit is great, is great. And I know that Dr. Izzy is real big on wellness, that's one of the things that he promotes. Is this something that you work with these new mothers?
It is, because if wellness is sought after while they're pregnant, then usually they have a healthy outcome with their baby, and it's something that they can kind of build on as the baby is growing
and guiding them. I would think in teaching them how to feed a child healthy, and I would think overfeeding could be a problem too.
I'm sure it is. Yes.
And I would think you see that that you know that I know it's often just easier to put a bottle in their mouth. With a small child like that, what do you think is a feeding schedule supposed to be? You said 3 to 4 hours. Do you think a child should be scheduled? A baby?
No, I do not. And it all depends too if your baby's breastfed or bottle fed. Your baby's breastfed, initially, they have to be fed on demand.
Right.
So, and then they start spacing that out. But if a baby's hungry, maybe they're not getting enough to adequately sustain them from feeding to feeding. So.
That would make a difference. Do you have a person that works with breastfeeding mothers here?
I typically do a lot of outreach and education here, and our nurses in the labor and delivery unit are very instrumental in that.
That's great. Well. That's great, because I know that breastfeeding is a great. It is. So there is not any area in the hospital that we're not hitting. I don't think we can take care of the geriatric patients, to the pediatric patients, to the newborns. I hope you'll consider Magee Hospital and consider the pediatric ward for your needs with your children. And I'm so impressed with Kelly, and I think, gosh, anybody that gets you as a nurse when the baby is born is going to be so fortunate, so fortunate.
I love these babies and I love their moms.
Well, you know what? You can just tell it in your face. You can just tell it in her face that she does, and it makes such a difference. Because I don't know, you go to so many doctors or whatever, nurses, whatever, and it's just like they don't even know you exist.
Right.
They don't even know you're there. And I don't think you're going to find this at all at Magee because we're intertwined. You know, just as she said, she's across the hall from the OBGYNs. You're right here with Izzy, and it's just a great thing. I hope, again, you'll consider Magee Hospital and check on Kelly and come see her. If you've got a new baby and you have not taken them to a pediatrician, come here to Magee. And if you're already using another one, consider coming to Magee and see Dr. Izzy and Kelly. I think you'll be pleased with what you find. Have a great day.